I'm Dr. Michele Bosworth, and I am a family physician with the University of Texas Health Science Center in Tyler. And today I want to talk to you about making informed decisions as a patient in the healthcare system. I think it's very important to really consider how we make informed decisions, and especially how it pertains to our own health and decisions for our family as well. One of the most important things about making an informed decision is really who your physician that you're going to choose. Many times your health insurance does have a set number of providers that you can choose from. And it's really important for you to research out those providers to see if they're a good fit for you. In terms of what are their focus areas, what do they have special knowledge in and their interests, and really determine if the practice that they practice in has the hours that you need to meet your needs for you and your family, or their after hours availability. Do they use an electronic health record, and do they have electronic communication so they can send portal messages to you or to your family members, which would be very helpful. The other thing to think about is, one, you want to make sure that if you're looking especially for a primary care physician, do you want to see someone who is a family physician, internal medicine? Internists generally are trained to see adults only, and family physicians are trained to see the whole family. So if you're looking for a physician who can take care of the whole family and see every single family member, then that may be the choice for you if your family does also include children. When you have decided which physician is a good fit for you, it's really important, even if after your first visit with them you don't quite feel it's a good fit, you could always try a different physician. So know that you have that power and that ability to choose somebody that is really a right fit for you. In the appointment with physicians, it's very, very vital that, one, you come prepared as a patient, bringing the information that we need to help make the best decisions to take care of you. One of the most important things that you can do is bring your medications with you and an accurate medication list. And then if a physician does decide they want to change or prescribe a new medication for you, then it's important for them to explain why and to make sure that you're okay with that prescription or that new medication, especially if there's any potential side effects. One of the questions I always ask my patients is, are you comfortable with this? Are you comfortable with this plan? I think that's very important that patients feel that they are informed with what the decision is that I'm going to make for them, and that really it's a decision that we make together. And I always don't like to just jump to prescribing medications for patients. A lot of times the answer is lifestyle changes, or getting patients enrolled in maybe a class such as a hypertension workshop, to make sure they understand all the different components that contribute to high blood pressure, for instance, or perhaps the patient is at risk for diabetes. And so what are the daily choices they're making in terms of their food, their exercise, their sleep, stress, etc., that is contributing to the risk of that disease or the worsening of that disease process. I've had a lot of patients who are just waiting for me to come up with a plan and see what I decide. And then they'll reveal some other information that might have been helpful in that decision process. It's very important that physicians understand, your smoking habits, your alcohol habits, your exercise habits. Are you taking your medications that have been prescribed? So ask questions. If you are having to have your knee replaced or having to have your toenail removed, you would definitely want to ask, well, how often does that physician do that procedure? And what are their complications that they've had or they've encountered from that?